used, things that I know that work. They are not the way, the only way, they're a way. So if you have a better way, by all means. And I'd like to see it, if you do have a better way. And these techniques were derived for speed and efficiency. So they're not complex, they're very efficient, and they can be applied quickly. Right? So first one, tourniquets. When do we use tourniquets?
Uncontrolled hemorrhage.
Uncontrolled hemorrhage.
Direct pressure.
Right. So in the past, it's been arterial bleeding, right? Only. So bright red spurting blood. Well, sometimes arterial bleeding is bright red spurting. Sometimes it's oozing. Sometimes, if it's dark, if it's low light, you don't know what color the blood is. So massive bleeding that you can't control with direct pressure, right? Well, I submit that tourniquet is a stopgap. It buys you time. So if you have a patient with, say, a gunshot wound to the leg with an arterial bleed and a sucking chest wound, 2 life threats, right? You can spend time putting a pressure dressing on that bleed while they're sucking all that air to into their chest, and that's going to kill them. Or you can put a tourniquet on in 10 seconds and fix a hole in the chest. So it's just a stopgap. Buys you time, fix all the other life threats, make sure they're breathing, and then readdress that wound. That makes sense? And the adage of people, once you put a tourniquet on, you can't take it off, they're going to lose a limb, blah, 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 blah. Bullshit. If we're only using it as a stopgap, it's only there long enough that we can readdress that wound. That makes sense? So, with an MCI situation, we're going to use a lot of tourniquets if we have a school shooting, something like that. Right now, if we go on a call, have a gunshot wound, we outnumber the patient 1 to 4. Probably not going to need a tourniquet. We can have a person pushing pressure on the wound. We can do pressure points. We can put a finger on the bleeder and transport to the hospital that way. Take 2 riders. Not really necessary to put a tourniquet on that if you can control it without it. Mass casualty, it's gonna be reversed. You're gonna have 4 patients with 1 medic if you're lucky. That's when we're gonna use tourniquets. So placement of tourniquets. You want to avoid radius ulna and tib fib. So you have 2 bones there. You have arteries and vessels that run in between those bones, and it's hard to get enough compression to stop that bleeding. So long bones, humerus, femur, is where you want to put them. 4 inches or 2 inches, 4 fingers, approximately above the wound. So if you have a gunshot wound, put your hand on there, put your tourniquet above that. The idea behind that is if those vessels are severed, they're going to constrict and retract, and you want to go high enough that you're capturing that artery. Types of tourniquets. We have, this is what we're going to carry in our MCI kits, cat tourniquet. I don't think these are the best tourniquet. I think this is what the biggest company that got a government contract. They work, but they also break. I've seen them, the trainers break. I don't know if, I talked to Wade yesterday, he's got a bunch of trainers, he said he's never seen one break, so I don't know if they've got better plastic in them, but I don't trust them 100%.
Which part is broken?
These little clips, these little plastic clips that retain the bar.
So let the bar spin.
Yeah, so the bar can spin. I mean, you still have Velcro there to hold it, but it's not ideal. Pass that around. This is what I did carry overseas, and what I still carry in my pack here. Tubular nylon and metal. These are plastic, but there's not a lot of retention in them. It just holds that bar.
What's that called?
It's soft tourniquet, SOF tourniquet.
Can we get it locally?
You can get it over the internet, yeah. I don't know about. Yeah, I don't know, through your means. If you don't have a ready-made tourniquet, there is always the field expedient. This is our triangular bandage. And after playing with this for a while, I don't like these. It's cheesecloth, right? My cravat girl. As opposed to a military cravat, you see the difference in durability. But regardless, it still works. You'll still stop blood flow, and if it's only on as a temporary means, it'll be just fine. So, the quickest way I know how to tie these, basically take triangular bandage in a third, right? So, a third of the tail here. Tie it around the stick, whatever you're using. Just needs to be durable enough that it's not going to break when you twist it, right? So you can use, syringe will work. You can use the rotoscope blade. Just keep in mind that you don't want to use stuff that you might need later on, obviously. Yeah, anything metal. So that's basically a third. Give me a thigh. Just some monster thighs. Yeah, stand up. Put your foot up there like that.
You don't want to fall over.
We won't laugh.
Eye contact.
So, like I said, about 4 inches above the wound on a long bone. And we're just gonna usually take the 2 ends, tie a square knot. And here's the problem with this triangular bandage. It's really narrow. So you tie your square knot. You want to have a little bit of distance between it and your stick, so you don't pull your knot into your stick. And you want to get it as tight as you can. The tighter you get it, the less twisting you have to do. It saves time. You're going to twist this. You're going to watch your bleeder. Once that bleeding stops, you're just going to take one of the ends, wrap it. You can even wrap around the other side if you want, and then tie your square knot. That holds it in place. So if you're in a hurry, less than 20 seconds. Get that tied up.
Thank you so much.
Are you just going as tight as you possibly can?
You're going until the bleeding stops, right? And that's not as tight as you can.
It's not always good.
No, it's tight. I mean, you're gonna cause some pain.
I don't think I've ever played.
You can these the cat or the other one you can put on your arm and tighten it until you lose your pulse, just to see how it feels. I mean, it's uncomfortable. It's not.
Have you ever had like where you put one of those on and a patient that's hypotensive, you get that bleeding under control after some fluid to treat their hypotension? Has it ever started bleeding again? You got to retighten them. Have you ever had that happen?
No, I've only medevaced one patient with tourniquets in place. So, way we use tourniquets, just like I said, just stop it. Put it on until I get a pressure dressing on whatever's bleeding. Then take it off or loosen it. Keep it in place, loosen it. Make sure that treatment's effective. If it's not effective, retighten the tourniquets. But it's possible.
Yeah.
Yeah.
So the old myth as to why you could not take a tourniquet off is that all of your vessels are vascular, right? And so they need oxygen for the muscles in your vessels to constrict. And the old myth was that when you put a tourniquet on, you've essentially restricted oxygen to those muscles of the vessels that allow for constriction and relaxation. And once you put a tourniquet on, and you cut off the oxygen supply to that vessel, the vessel distal to that tourniquet no longer has the ability to vasoconstrict and stop its own bleeding. So what they were afraid of was that once you took that tourniquet off, say you use it as a stopgap, you put it on to slow the bleeding so you can address the bleeding, and then you loosen it or take it off entirely, that now that vessel does not have its intrinsic ability to occlude itself, which many vessels do. As it's been demonstrated over time in most of the military, is that theoretically that is correct, that should happen, it just doesn't. It's not a concern, which is why the use of tourniquets, which were a absolutely last-ditch effort 15, 20 years ago, now have, because those fears weren't ever realized in the field, now becomes a very practical, much sooner intervention. Does that make sense?
And special operations have been using them since the 60s in Vietnam. Macri saw it used them all the time. Let's practice tourniquets. Feel the speedy ones, and then my wound packing. So we have a bleeder, an arterial bleed, somewhere in this vessel. This is green is artery. This is bone. Breaking the skin. We can have bright red spurting blood. We could have pooling blood. We just have a significant amount of blood coming out of that vessel. Wound packing is not shoving Curlex in a hole. There's a little technique to it. What we're going to do is take a roll of Curlex, make a ball in the end of it, tight little ball. This is the type of wound that you can see. You can see the bleeder. You see the if these are spurting out or it's pooling in there significantly. We can take the roll of Curlex and wipe that out, wipe that pooling blood out, and you'll be able to see where that blood's coming from. And you can actually take your glove finger, put your finger on there, and stop that bleeding. So basically, we're going to take this little ball, and that's going to replace our finger. I'm going to push this right against that vessel, and what we're trying to do is put pressure on this vessel against the bone. And we're keeping that pressure there with the Curlex. So we're going to take the Curlex, and we're basically going to build up that area around there. So we have our roll of Curlex here, putting pressure on there. We're going to slowly build up the Curlex in that cavity. So when we put our pressure from above, we're basically putting pressure on that pinpoint area there where the bleed is. So a quick demo. This is the bleeder. It's inside my hand. I'm putting pressure with that little ball. I'm going to let it sit there for a second or two just to make sure there's no more bleeding coming from anywhere else, and I actually identified the right spot. And then I'm just going to slowly, some Curlex here. I'm just going to slowly, keeping pressure on that ball the whole time, just build up the area around that ball until I've got that wound cavity completely packed. And then whatever remaining Curlex I have, I can either wrap it or just put it on top and then use another wrap. And so if I have a bleeder here, I'm going to do that. My little ball, I'm going to pack that wound. Any remaining bulk is going to be on top. Hold that. There's a couple different methods for getting pressure on that. Simplest one is triangular bandages. Take 2 of them. First one, you're just gonna, again, make a little tight little ball, tight as you can. That's gonna go right on top of, putting pressure directly down on that little ball of Curlex. Take the second one, wrap that over the top. Tie a square knot directly over that ball. You can tuck your tails in, dress it up however you want, wrap some tape around it, whatever. You should be able to get more than 1 finger underneath this. That's how tight it should be. Alright, like that. Another method. with ace wrap. Make sure you hold the ace wrap this way so you unroll it. It works for you as opposed to fighting against it this way. Just gonna go over the top. Wrap it a few times to secure the dressing. This also keeps it clean depending on the kind of environment you're in. I'm just gonna wrap it tightly. To get more pressure, just twist that Curlex right over the top. You can also use the triangular bandage underneath the ace wrap to get more pressure there. A few times, twist directly over there. When you get to the end, you can just tape that off, or quicker method, just tuck the tail in. Third method with the Israeli dressing. Comes in a package like that. Open it up. It says other side to wound in true military fashion. Open it up. You get your bandage on this side. You can use this without the packing if it's just a superficial wound. Put that right over the top. Wrap on both sides, secure it in place, and keep it clean. And go inside this plastic clip and then back the opposite direction. And when we get to the end, this plastic clip here, and you can just loop this anywhere you find an end of the bandage. Clip it on both sides. And with any of these methods, the old adage, assess, treat, reassess. We assess, he's bleeding, treated it, then periodically reassess. All you gotta do on these, especially with Curlex, is just push on it. If it seeps blood out of it, then it's not effective. You need to add more pressure or reevaluate your dressing. We can go a couple different things.
Hey, too, when you're wrapping that's pretty tight pressure.
Right.
Right. It's not loose.
That's not where your pressure is going to come from, but you might as well wrap it as tightly as you can to get more pressure. So that wound's packed. We have that ball on top. You can take our trusty triangular bandage, make it a real tight ball with it. And you're going to want to put that right on top of where that ball is, right? So we want all this pressure going down to that one point. Then ace wrap. When you use ace wrap, roll it so it works for you, not against you. Makes sense? I can unroll it easily this way. This way, it's going to be cumbersome. Keep in mind that most of that Curlex is going to be in a hole or wrapped around the top. And you can twist this ace wrap once you get it tight. Twist it right over the top of that. That's going to give you a significant amount of pressure. So when you get to the end, hold that. You spend about 5 minutes searching for your little metal clips that came on your ace wrap, or just grab some tape. Put some tape on it. Easy way to check is push on this. If it seeps blood, it's not working. Tighten your tourniquet back up.
So the interesting thing about this is that this is a circumferential wrap, right? But having this packed in here above the level of the skin puts considerably more pressure underneath this knot of Kerlix. So I can feel the circumferential pressure, but I feel the most pressure right here. Whereas if this only came up to the level of the skin, I would feel even circumferential pressure around. So when you guys do this on each other, make sure that the person can feel the majority of the pressure being right under the mound you've created, because that's what you need to essentially occlude this vessel. Does that make sense?
And circumferential pressure works with like venous bleeding and capillary bleeding. If there's no arterial bleed, you can just use like an Israeli dressing. You're not getting, with these dressings, you're not getting that pressure point. You're just getting a broad pressure all the way around the wound, which will work for venous bleeding, but for arterial bleeding it won't.
You said tighten the tourniquet. Is this, you're not going to start this process until after you apply the tourniquet to stop most of the blood flow?
Depends on the situation, right? So if this is the MCI and I threw a tourniquet on him when we were doing triage. Now he's in the treatment. I'm gonna put this on and then loosen the tourniquet.
Okay.
Make sure
and
it
then
works.
watch to see if it seeps.
Or you can loosen the tourniquet up a little bit so you can actually see where it's bleeding, and then put your pressure dressing on there. But keep that tourniquet where it's readily available. You can tighten it back up if you can't get pressure on it right away.
So this wound packing works as well as the tourniquet does if it's done properly?
Yes. I mean, it's
Providing
you can ID the bleeder.
you can find the bleeder and you can put the right amount of pressure out.
Right.
But my, when he just wrapped this, I mean, my hand is as numb as it was when we were doing tourniquets.
So you've lost circulation there.
Yeah, I've got complete no refill on my skin when you pinch it.
Which might be a little tight, a little too tight.
Well, but not if you're trying to occlude this vessel.
Right. So some other techniques for that same, if you don't have ace wrap.
So you're not concerned with pulses or anything so much doing something like this?
I mean, you always want circulation, but if it's the main artery that's feeding that arm, and it's either he's going to bleed to death or he's going to lose pulses in his wrist, then I'm going to go with stopping bleeding.
And it's similar as a tourniquet, right? I mean, the tourniquet does the same thing, and we can leave those on for longer than we used to think, right? And things.
Well, I think this is probably going to give you more peripheral circulation than leaving a tourniquet in place. So
Tourniquet cuts off everything. This is just stopping, hopefully, what's
bleeding.
bleeding.
Right.
Yeah.
Coban is not.
So you can't use Coban. Past life, we didn't circumferential wrap Coban. We didn't circumferential wrap tape, just because for long term, if with that circumferential wrap it doesn't have any give, swelling with an injury, you're going to cause tissue necrosis and you're going to cut off circulation.
Okay.
Here, I don't see an issue with it, with circumferential wrapping tape, because I mean we're not going to have a patient for more than a couple hours in a worst case scenario. They're going to be at a hospital where they're going to take that bandage off, see what's going on anyway. What I don't like about Coban is with the movement of the patient, that Coban sticks to itself. So you can start with a wide bandage. By the time they move a little bit, you're going to have a narrow strip on there.
trying to put it on this real pitch.
Yeah.
Especially in this situation when you're trying to put it over a mount, because when you put it on the side of the mount, it's either going to roll on itself or displace the mount. This is a nice wide.
I'm just trying to get it started.
So if you don't have ace wrap, you run out of ace wrap. So our Kerlix is on there. take your ball of triangular bandage again, set that on there. Take another triangular bandage. That just came out of the package because it's a lot easier.
Just like a ball of cling be okay too?
You want it somewhat dense.
Okay.
Cling's hard to get that dense.
Okay.
4x4s, full, stack of 4x4s shoved on the top of that. We'd rather not use that as well.
It's hard to get with a square, even if you roll it up. It's not. You can have a lot of gaps in there.
Okay.
That makes sense. You can try it, see if you can get it, if it's effective. But the thing I don't like about using 4x4s as opposed to acrylics is, like for wound packing, I mean, you have to pull each one out individually in order for it to be effective. You can't just take one, stick it in there, because you're trying to cover all that space in that hole with a square, which you're going to have gaps in it. Does that make sense? So take your triangular bandage over the top, take your tails tight, tie a square knot right on top of that ball. Tuck your tails in and make it pretty. So they don't get caught on tree branches. And same basic concept, but not as effective as the ace wrap. What's that?
Just what you said, ace probably would be better.
Right.
Absolutely. I don't know how hard you were trying.
Not real.
This is nothing
Right.
like this one. And it'd probably take two people to tie that knot without losing.
Put your
tension.
finger here.
Exactly.
Haji.
I see you have an iPad.
Tonight's 6 o'clock.
That's right. Doing it the Camas way.
Creative editing. Yeah, let's practice those. Has nice instructions, other side to wound.
Oh, you put it on this way.
Yeah.
So this has a little clip on it. You can wrap both sides to secure it in place so it doesn't slide. And then this side goes inside those clips. This is where you get your leverage, your change of direction, going back the opposite direction.
Do you want that leverage to be on your wound packing?
Yes. I mean, it's going to give circumferential pressure, basically through here.
Yeah.
So as long as it's
So that in effect is the same thing as the twist, but
yeah, yeah, basically. With basically curlex in the ace wrap with a plastic.
A twist.
And once you get to the end, you get this handy thing to eliminate tape. So it's just a clip that's going to clip onto the bandage itself, wherever you can find a spot. And they're nice because it's an all-in-one type thing. You don't need acrylics and ace wrap tape. It's all right there.
But that's after your wound packing.
Right, you're still, yeah, I mean, it's just a dressing, right? So you're still going to need to pack and you're still going to need something to put pressure down. But, I mean, for severe bleeding with, that's not an arterial bleed, these work great.
Opposite of packing, and if you had an arterial bleed, you pack it and use that
Right.
in place of your ace wrap.
Mm-hmm.
Useless, right?
It's a good idea.
Does nothing, in my opinion.
protects us from the trauma.
That's right.
It's kind of
Keeps all that blood from getting all
like
caught.
putting a sticky note over a wound, Andrew?
Keeps you from realizing you have to do more.
Right, Andrew? What? Like a sticky note?
Do you mind? Thank you, sir.
Gross stuff.
Yeah.
So we need an arm. So we're going to cover amputations. So amputations, can happen for a number of reasons, and depending on what that reason is, your wound is going to be very different. It can be severed, right, from a blade or a piece of machinery, or it can be from a blast. Or fireworks or a cannon, right, Nick? So Ober had a traumatic amputation Camas. A guy cleaning out his cannon with a drill, the arm over the front of it. With it loaded, cannon went off, blew his arm off. So with those types of injuries, you're going to have a mess of flapping skin, all the debris that's pushed up into that. We had a lot of landmines, kids, people stepping on landmines, and it blows all that dirt, rock, debris up into the appendage or the extremity. Yeah, sterility is very important at that point. But you're also going to have a lot of cauterization, so it's not you're not going to have a lot of bleeding, even with if it's severed. Like I said, those vessels tend to constrict and retract. Not a lot of bleeding right away. Eventually, you're going to have bleeding, right? When all that patient starts to decompensate, everything relaxes, you're going to have bleeding. So before you address the stump, I would say put a tourniquet on. Don't apply pressure, but just keep it there so it's in place when it does start to bleed if this bandaging is not effective. So let's make a fist. So his arm's cut off for whatever reason. We're going to take normal packing and we're going to pack that wound, put Kerlix everywhere we can. Stuff it inside.
Are you trying to find any bleeders and do
if you can
ball
get
thing
if you can get pressure on those bleeders, by all means. But like I said, it's going to be, from the ones I've seen, slow venous bleeding in there. So just the fact that you put Kerlix in there, and then with this pressure, it's gonna stop that bleeding. Yeah.
Did you start with your wad down low for a reason, and then came over the stump?
I mean, I just anchored it. If this was an actual amputation and I had skin flaps, I would just start stuffing the Kerlix in there, all the holes, like all the gaps I can see.
Okay.
We're going to take our ace wrap. We're going to start with making an anchor point on part of the appendage that's still good. That way we can get downward pressure this way. Pressure, I'm going to grab it with my thumb and finger. I'm just going to keep working back and forth. And at the end,
amount of downward pressure.
I'm going to wrap to lock those in place. If I need to, I can grab another ace wrap. I need another one. Just start where I left off. Make another anchor point. And you can do the same technique of twisting, putting more pressure on there. What? How's that feel, Eric?
It's feel comfortable. It's tight. And there's a lot of downward, like, there's a lot of, I mean, that's me trying to move my fingers. Can't move them.
And then just pull that in place. Any questions on that?
That's good. Looks like a turkey then.
Facial bleeds, head trauma, head bleeds. They're easy to control with direct pressure, right? Because you always have something very hard to push against. So you can compress that bleeder against the bone. But I would say, with airway considerations, if you can intubate before you press the wound, it's a lot easier. If you have bleeding in the mouth, arterial bleed in the mouth, you can control it with direct pressure. But if you can get a tube in you can do whatever you need to do without having to worry about the airway. So just something to think about. I've seen great bandages applied to semi-conscious patients, and then they need intubated. I take my bandage off to get it to
Kind of what?
I've had
Been meeting a lot of challenges.
uh,
A lot of challenges. Though.
axillary wounds, so bleeders inside the armpit area. You can get a fairly big cavity in there. You can pack quite a bit of Curlex into that cavity, and it's difficult to wrap and get direct pressure, because once you wrap around here, you have that inside the armpit, so you're getting pressure this way, but you're not getting pressure up into it. Does that make sense? What we would do is we use balsa wood splints. It's just a 1/8-inch thick board. Put Curlex on top of that, shove that up into, after you pack the wound, put the board up there, and then splint that in place, so you're getting pressure this way. We don't really have anything like that. Cardboard.
Under the bottom of the board and up over the shoulder.
I'll show you in a second. Cardboard splints I don't think would work very well because they just crumble. If he doesn't have a femur fracture, in addition to that, this is about the only thing I've found that we carry that would work. So it could be an injury with body armor. You have plate here, you have soft armor on the side. Soft armor is only effective for shrapnel and small arms, like pistol type rounds. So it's possible that cops can get shot underneath that, or through that soft armor. So Butch?
Good point, Butch.
So we're going to go ahead and address that wound just like we've done before, right? We're going to try to identify that bleeder, pack as much Curlex in there as we need to keep that bandage in place. But in order to get pressure up this way, we can take this, throw a piece of tape on there to keep it in place. Or you can use a triangular bandage, whatever, to get a nice little ball on there. So we're basically trying to get force up this way to hold pressure on that bleed. Does that make sense? We can wrap underneath this thing, pull pressure upward. As was pointed out yesterday, there's a convenient strap on this thing that we can use. I mean, it's definitely a low frequency injury, but when they do happen, they're very difficult. So once that's in place, we take that and then basically put a sling or a swath around the body to hold that in place. You got pressure on anything?
You can almost, I don't know if you could anchor that strap around the other side.
Around this way?
Just even, not even around the neck, but even around the opposing arm or the torso.
But just an idea, just to.
That was pulled out from the side, so it was a big gaping wound there without an arm attached.
Yeah, right. Yeah.
That's a problem.
Anyway, and he had some bleeders in there. Yeah. To crew too, that's good enough. Anyway, what's your thought on a massive injury like this? No arm attached, but obviously large arteries probably in there.
why if I would clamp, use the status and clamp what I could see here, since we're not allowed to do that, I would just go with the pressure with the Curlex and try to get as much pressure as I could. It'd be hard to get pressure that way. You'd have to go all the way around the torso in order to get pressure.
Might be
this
a
way.
manual hold.
Yeah, with that one, I mean, it was such a, I mean, once we got to the water, it saw what it looked like. Long story, I think I said one long story. You said, like,
Yeah.
drinking again.
Yeah, and the reason it was a
But yeah,
long
there
story.
was so much soft tissue attached to the shoulders. I mean, it's still there, but it wasn't.
And the reason it was a long story is because some dipshit put one of these on
Yeah.
and said it was good.
Yeah,
Right?
whenever a
So-
volunteer says it's a full thickness lacerations, everything's fine, and it was on there and it was wrapped, and I'm like, okay, let's make it a trauma alert for the hell of it. And then all of a sudden it's like, oh, he's really diaphoretic. Oh, he has no radial pulse. Oh, he's getting combative. Oh, it's bleeding through.
I'm glad I made this a trauma alert.
When a volley says that, look at it. Learn from what I had to go through.
Yeah, like I said in the beginning, these techniques work. I've used them. I know they work. Like I said earlier when we were talking about tourniquets, I only medevaced one guy with tourniquets in place. That bleeding couldn't be controlled. So, and that was from basically anti-tank mines that went off underneath an up-armored vehicle. So it was a blast injury that, I mean, his feet were basically mush. So, bleeding everywhere. Tip fib, bilateral tip fib fractures. Other than that, these work. So, some tools for your toolbox. Any questions?
Alright, so this is just to start. The, you know, this, all of this, well, not all of this stuff, because, you know, Tierney's given us lots of tidbits to help us, but a lot of this stuff we learn in EMT and medic school, but with the trauma in our system and most, you know, civilian systems, we don't get a lot and we don't work on this stuff. Active shooters have kind of brought a new threat to our normal, relatively trauma-free world. So we need to brush up on these. This, as you can see, especially with the amputation stuff, this takes practice. It's your responsibility to get good at this stuff. You have the equipment, you can practice anytime, practice on each other, do it as a, you know, company evolution. Get everybody involved. You know, now you know how to do it. It's your job to be proficient at it from here on out. But
Question, any trick of the trade for like a shooting to the neck with the carotid bleed? That's not, you know, where they're like, fixing to die real quick. I mean, how you can do a pressure dressing or a pack, you know, or a neck wound that's not necessarily like spurting where they're gonna die.
Are you
It's
afraid
like,
of it?
like it's uncontrolled. Anything there?
I don't, besides direct pressure. And if you have manpower, to keep direct pressure on.